ASH 2021, we have a presentation focusing on genomic and immune signatures predicting sustained MRD negativity in newly diagnosed patients with myeloma treated with the 4-drug combination Daratumumab, Carfilzomib, Lenalidomide, and Dexamethasone. We published the clinical part of this study, the Manhattan trial, earlier in 2021 in Immuno-Oncology, and we found unbelievable 71% MRD negativity, and this was in the absence of a bone marrow transplant. So very, very strong results, fantastic efficacy, and also very well-tolerated therapy. But because there are 100% and we only reached 71, and we also didn't have sustained MRD negativity as part of the initial paper, it was reaching MRD as the primary endpoint. We were motivated to study further beyond this first publication to see, first of all, what is the rate of sustained MRD negativity? And most interestingly on our end was to focus on the molecular underpinnings of sustained MRD negativity versus not reaching MRD negativity, or reaching MRD negativity and losing MRD negativity. And at this presentation that we have here at ASH, we find very strong evidence of a complex interplay between the immune microenvironment and tumor genomics. We conducted single-cell sequencing of bone marrow aspirates, and we studied the microenvironment. And then we did also whole-genome sequencing of the tumor cells, and we were able to carve out a lot of very exciting new data. What we identified are many novel myeloma genomic factors that are associated with sustained MRD negativity in these patients treated with this modern 4-drug immunotherapy. We also observed several immune microenvironment patterns that were found both at baseline and during and after treatment that was associated with sustained MRD negativity. So I think this study provides a lot of new important insight. It's a very modern 4-drug combination. It provides new insights on the role of the microenvironment. We have talked about the microenvironment for many years, but we have not really been able to carve out detailed information. And as the therapies have gotten better and better, this is a moving target. Every time we have to sort of redo the work and look in the context of newer therapies. So here we have a very new combination, 4-drug combination therapy. I think a top-line deliverable with this study is that we probably in future studies should require integrated assays that capture both the immune microenvironment and the tumor genomics if we want to better understand mechanisms of resistance and also mechanisms of sustained MRD negativity.